session to questions and answers. So today, as you know, we're talking about HealthTree University, free myeloma education for all. You might know that the HealthTree Foundation offers free, organized myeloma education for patients and caregivers. From the very basics, what is myeloma, what is an M-spike, to the complicated new research being published, you can start your education and learn more about myeloma today, no matter where you are in your myeloma journey. Patients, caregivers, friends, family members can all participate in HealthTree University. And then you can spend less time in your doctor's visits trying to understand the disease and your treatments and have educated conversations that apply directly to you and your journey on how to best improve your care and survival. So as I mentioned, Cindy Chmielewski is here with us today. She's a professional educator and myeloma advocate. She's a former teacher who now teaches myeloma patients how to advocate for themselves as the director of HealthTree University. She has a successful following of her Twitter account at Myeloma Teacher, in case you want to follow her, and always enjoys time with her family and cute furry friends. So Cindy,
annoying.
But they're cute, annoying but cute. Cindy, the time's now yours to share your story about kind of how you got involved, and then why is HealthTree University so important?
Okay, thank you for the kind introduction, and hello everyone out there in Zoom land, whatever we call it these days. And I thought I'd just share a little bit about me, because I'm not sure how many people on the call do know who I am, and a little bit about my story, and then how I met Jenny, and then spend the rest of the time just going through HealthTree University and sharing, all the tools that are available on the university. So about me, I was diagnosed with multiple myeloma back in 2008. And in 2008, I was a fifth grade teacher. I was in my 40s. I was not planning on retiring or anything anytime soon, but I was having a lot of really bad back pain, and to the point where I really couldn't do my job anymore. So I went to an orthopedic doctor, because usually when you have back pain, that's where you think you would go to, an orthopedic doctor. And the orthopedic doctor diagnosed me with degenerative disc disease, and he prescribed like physical therapy and pain medication for me. And he did all this without doing any imaging of my back, no MRIs, no x-rays. So that was kind of a little red flag to me. But, back in 2008, I was brought up in that age of doctor knows best. And I thought that, questioning the doctor as to why no imaging was done, or asking questions about how he came up with my diagnosis, would have been rude. So I didn't do that. But unfortunately, my back pain really didn't get any better. It actually got worse. And finally, it was about 2 years later. This all started in 2006. About 2 years later, I just went in tears saying, I just can't stand this any longer. I can't do my job. I cannot do recess duty. So it was at that point, he decided to take an x-ray of my back. And the x-ray machine was right next door. I just couldn't believe that it was that easy to walk from one room to the other room, get an x-ray, and within minutes, he had the results, and he discovered that I had several compression fractures, and I was scheduled to have surgery to repair those fractures. And part of the pre-surgery protocol made me get some blood work done, because I was going to be put under anesthesia. The blood work came back very abnormal. I was referred to a hematologist, and the rest of the story is history. I was diagnosed with multiple myeloma. I was stage 3 IgG kappa myeloma. My M-spike was very, very high. And I had to begin treatment immediately. And back in 2008, though, the treatments that are available today were not available. Many of them, some were, but not all of them. And it was very common in 2008 to start treatment with a doublet, just 2 drugs, instead of triplets, or now they're doing quadruplets, because it was very common practice for many of the myeloma specialists to think like, okay, we need to save some of our drugs just in case you relapse. And we didn't have all the drugs that are available now. So I started on Revdex, and for the first 2 cycles, I responded very well. I was happy. And I just want to go back. I made that choice of starting on Revdex because it was what my doctor recommended and because it was an oral therapy. I really didn't even know what questions to ask my doctor. I didn't ask how effective it was. I didn't ask, are there any side effects? I didn't ask how long was my course of treatment. I didn't ask any of those questions that I would have asked now. I just didn't know what to ask. I just took the drug because that's what my doctor told me I should be doing. And then by the 3rd cycle of my treatment, my M spike reached a plateau. It just stayed just like this. It wasn't going down any further. And then it started inching its way up. And it was at that time my myeloma specialist became very concerned. Although I didn't have those myeloma aggressive chromosomal markers that would have put me in a high risk category, because I stopped responding so quickly to a treatment that many were responding for a long time to, he decided that I needed to go to transplant right away and to try to knock down my myeloma as quickly as possible. So I did. I followed the advice of the expert and went to transplant. And mind you, my M spike was still quite high at that time. But my myeloma specialist was kind of convinced that this high dose chemotherapy will do the job of knocking down that M spike at least to a very low level. Well, 100 days post-transplant, we did the basic restaging test, and my transplant had no effect whatsoever. My myeloma markers going into transplant and coming out of transplant were exactly the same. And I was just devastated that, I went through this and now the transplant didn't work, Revdex didn't work. I just had myself as a goner. But it was at that point, my doctor was still very hopeful, and he gave me some treatment options to consider. He said we could do another transplant, we could do Velcade index, we could try an older drug, thalidomide, we could do all these things, or we could look for clinical trials. But ultimately, that choice of which direction we were going to go, because there was no definite next step, was going to be mine. And I think that's when I had my aha moment, that if I am going to be part of this team and I'm going to make informed decisions, I needed to educate myself. Up until that point, I was just relying on everybody else to tell me what to do. But now I knew that, this was going to be a long game. And if I wanted the best outcome, I needed to be part of it, and I needed to be educated to do that. And that's when I started, attending webinars. I read everything I could. And over the period of the next maybe 2 years, I went from this passive bystander in my care to an informed partner. I started a Twitter account on social media and a Facebook page, and started sharing all these things that I was learning, because remember, I'm a teacher. So teachers by nature want to share everything that they're learning with others so other people can benefit. And in this time also, I guess people were taking notice, and I was invited to partake in some advisory boards for some of the pharmaceutical companies, like looking at what was coming up, looking at patient materials, looking at trial protocols. But also on this advisory board, or these advisory boards, Jenny would always be there, because Jenny was doing her own thing with the myeloma crowd and starting the radio show and doing the myeloma crowd roundtables and providing information to the myeloma community in a different way than I was. And we became friends, and always looked forward to meeting her at all these events that we were attending. And it was at one of these events, she said, I have an idea, Cindy. I think we need to create a university for myeloma. We need to be able to put all this information that people need in one place. And she said, listening to you talk at these meetings and knowing your background as a teacher, I think you would be the perfect person to be the director of the curriculum of this university. And I'm like, wow, that sounded like a nice idea, but I really didn't know how this was going to pan out, what we were going to do. I knew I couldn't be the teacher. I could develop the curriculum. I could know what things people needed to know. I could put them in a sequence and in a logical order and build from very simple to more complex because I was used to doing that, but I couldn't present the material. So we were thinking, how could we do this? And that's when we had to brainstorm that we were going to interview myeloma specialists and ask myeloma specialists these questions so that they were providing the answers to the questions, so that the answers that you were getting were the answers you would get if you were going to your myeloma doctor and he was telling you or she was telling you the answer to that question. So we started very humbly because we had really no financial support in the beginning. We were just going out and trying to build a HealthTree University, and we would interview doctors on Zoom. And this was pre-COVID days, before doctors even knew about Zoom. Many of the doctors didn't even have webcams on their computers because in your office computer, they really didn't need it. So we were interviewing doctors that were holding up their cell phones, talking to us. And we got those interviews, and then we added animations, and it just started progressing. And now we have some funding, and with the funding, it allows me to attend different meetings. So for two reasons. First of all, this way, when I attend these meetings, I learn what's the newest things that are happening in the field of myeloma or how things are changed. So this way we could include that information into HealthTree University. But I also have the opportunity to interview doctors live at the meetings, and they're so very gracious with their time. And we set up times. I send them questions ahead of time. They come and they answer the questions for us. And then if they have any research they're presenting, they share that research with us. And then we go back and make them into different classes and units on HealthTree University. So I guess that's a big enough background about myself, how I met Jenny, what HealthTree University is, how we gather our material. So now I'm going to see if I could share my screen and walk you through HealthTree University. So, and Audrey, am I sharing my screen?
Yes, that looks great.
Okay, good. So this is HealthTree University. You could get it in several different ways. You could type the URL that's up here, healthtree.org/myeloma/university courses. If you just go to the HealthTree website, you could just always click on university. And if you click on university, which is on this top banner up here, then you could get started. And the nice thing about HealthTree University, you could do it in two ways. If you have a HealthTree account, when you sign in through your HealthTree account, there are special features that I'll be talking about that are active as a user with an account. But if you don't have a HealthTree account, we thought that the information here was just too valuable just to say, if you don't have a HealthTree account, you can't watch it. So you could still watch the videos when you don't have the HealthTree account. You could still use some of the search and things like that. You just can't use the notebook or the bookmark your lessons or do points, because all that information is linked back to your HealthTree accounts. So let's get started. If you look down, if you go to courses, let's start with courses. When you click on courses, this is what comes up. And you will see that our courses are divided into units. In the beginning, it's myeloma basics 1, 2, and 3. Then we did a course in myeloma basics in Spanish. And then we have some courses, and I'll talk a little bit about what beta means in development. And we have lots and lots of courses. And in the beginning, they're basics, But as we get further down, we're getting more into immunotherapies. We talk about genetics, imaging, MRD testing. So it gets more and more complex the further you get down into the curriculum. And well, let's start with just looking at things. If I want to go to know your therapy, if I'm being prescribed a new therapy and I want to know about that therapy, I could go to that unit, then I could click to see what the lectures are in that unit. And here are all the lectures that are in the unit about know your therapy. And if I click on the specific lecture, like all about Darzalex, it will start playing. And you will see as we go through the lecture, there'll be animations, there'll be information, there'll be different things that will be helpful for you to understand.
Complementary pathway, public complement pathway.
But also, we were told that sometimes people like reading transcripts. Right now, they're not the best, but what we've done is we imported transcripts from YouTube. So anything that how they do a YouTube transcript will be here. There are no punctuation, so sometimes it's a little bit harder to read. And there might be some words that get mixed up a little bit, but it does have a transcript of what the lesson is about. And then after the lesson, you could take a quiz. I've completed this quiz. And for everything you get correct in the quiz, you score a point. Now let me go back to a different lecture. Let's see. If I want to go back to another lecture in this unit, I could just choose this bar across the top. Say if I want to go to, okay, well, now it's not working that way. So we'll stop it and I'll go back. If all else fails, I always just go back to courses and I get back to where I need to be. And if I go to a different lecture that I didn't take a quiz for, it will start. This is all about Revlimid. And if I take the quiz, you can see right now, I have 5 points. That's because I got 5 points from the Darzalex lecture. But here, I could take this lecture. Revlimid is approved oral agent for newly diagnosed. True. Oh, I got it correct. Here, I'm going to say ignore them. Uh-oh, I'm incorrect. And then they tell me what the right answer is. And then anytime I get, I'm just going to go through without reading these, just see, oh my gosh, I get lucky without reading. And you could see now at the point store, I got 3 more, so I get 3 more points there. So that's something. Oops, let me stop. Oops, I stopped the wrong thing.
All about pommeless or pomalidomide.
So pomalidomide is
Let me stop it here. So that kind of shows you where the points are coming from. The points that you get are from the questions that you answer correctly that are in the quiz that's after each of the videos. Now, eventually, and actually we're having a meeting in the next week or 2 to really develop it, there'll be a point store that with your accumulated points, you could claim different rewards. Right now, we just have our hat, our HealthTree Foundation hat in the point store, but there will be different rewards that you can claim as your points. Going back to courses, the next thing says Bookmark Lessons. If you look down this tab over here, and if you go to Bookmark Lessons, these are lessons that I want to remember, and these were lessons that I just bookmarked that, I thought were maybe important that I might have wanted to review or go back to or share with somebody else. So if you want to know how to bookmark a lesson, if you go back to your courses and let's look at Myeloma Basics 2, here's my lessons. And if I wanted to know what tests I needed to do to confirm a diagnosis, and I wanted to keep that at the top of my list because I thought that was a really good video and it was something I wanted to discuss with my family, or if it's something I wanted to discuss maybe with my doctor, I could hit the bookmark. And now when I go to Bookmark Lessons, it shows me down here in Myeloma Basics 2, what tests should be done to confirm my diagnosis. So this could be an ongoing list of lessons that I thought were particularly good that I want to go back to, or I have a question about, and I want to ask my doctor about it, so I don't have to go through everything again. Also, we've developed is a notebook. And once again, let me go back to my courses. And if I'm going to starting treatment, I'll go to my lectures. And let's see, what are the most common myeloma drugs? Let's me get to that. And I can watch the last. And then if I wanted to take a note about that, I could go down to this corner where it says notes. And I could say, ask my doctor, should I use a quadruplet? And I can't spell and I can't type, but here we go. And now it's auto-saved. And then if I go back to my notebook, all the questions that I want to ask, or all the notes I wanted to take, like I could ask questions, I could take notes, are saved in my notebook, and they're saved in my notebook under which unit they are. And if it's something it was just a question, and after I ask my doctor that question, if I want to delete that note, that's fine. But if it was something I want to keep because it was a note for me, something to help me understand something, that would be something that I would keep. And if there's a whole bunch of questions that I have for my doctor, there's this print notes feature that I could click and it will download my notes as a PDF. And then I could print the PDF of my notes. So that's the little notebook that you could have while you were taking a class. Going back to the courses too. Let's see, go down to precursor conditions. Now, precursor conditions are changing all the time. I mean, when we go to those meetings, what we learned at one meeting, at the next meeting, they're changed. And sometimes it's really impossible to go back to every single lecture that we had to update them. We try to go through the ones that we know when a new drug's approved, a new indication's approved, but sometimes there's something embedded in a lesson that we really forgot about maybe. So if there's something in a lesson that you see and you don't think is right or needs to be updated, there is, and I can't find it now, but there's a place, yeah, down here. That's why I couldn't find it because my bar was there. It says, give us feedback. And you could write here, in this lesson, it said so-and-so and so-and-so, but I think this may be wrong at timestamp so-and-so. Would you please check it out? And you could submit it to us, and then it will go to one of our production team members, and then we would put it in our Trello board so that we can help do it again. Let's see, how can I get rid of that? Let me just go back to courses again. And then no university is complete without a library. So we have our library. Now our library is a work in progress, and actually we could use help on that. And what we're doing is we're organizing the most important topics in our library. And let's see, like we figured a complete guide to stem cell transplant would be important. So we have this, and then here's our content. And under this, we're having people work, and lots of times it's a lot of the myeloma coaches that are putting in many hours to really come up with what they think is important and then collate all the resources we have. So there'll be articles on this. There'll be HealthTree University videos on this topic. There'll be lots of things. So in our library, excuse me, it's just like any other library. It's all the information that you may need to have on a particular topic. And it's an evolving living library. It's ongoing. We add to it as we can. And it's something that will never be complete, and we're constantly working on. And let me go back to the university again. So right now I'm out of the university, and to get back, I could just click up here to go back to the university, and I could enter get started again. And I just wanted to show you some other things. Then we have our faculty, and we have a big faculty from around the world. It continues to grow. In the beginning, some doctors weren't too sure. Now, I was just at a meeting in Salt Lake City at the tandem meeting. I had doctors messaging me on Twitter saying they were there and can they be part of the university? So now doctors are asking to be part of the university when I'm at a meeting, instead of me having to reach out to them and seeing if they would likely be on the university. So that's our university faculty. And then if we look again, you will see sometimes you'll see a word such as beta. Now, if a course or courses are in beta, what that means is it's kind of like raw video. We have the intros and the outros. We cut away all my asking questions and all maybe the nonsense talk before and after, but it's just the meat of things. So all of these videos that are in beta are great. They're informative. The doctors are answering these questions. They just don't have the pretty illustrations. They don't have the voiceovers. They don't have a lot of the other things that make our other videos a little bit easier to watch, but they do contain the information. So beta videos just mean they're still under construction, but you could watch them. Another thing you will see is coming soon. Our coming soon videos, actually, we have them down here in beta, unsorted, all mixed up. But when they're coming soon, it means that these are the current units that we're working on. So be looking for them to be published and updated real soon, because we're getting close to publishing them. But if they're not already here, you could see them in the beta under unsorted. So let's see. And some other features maybe, let me check something. Starting treatment, let's try that. You will also see after our lessons, there's beta here. Oh, you'll see these things that are called guest lectures. What guest lectures are meetings that were done through one of the HealthTree's programs. That might have been one of Audrey's meetings at one of her groups, where doctors was explaining something and it was recorded, like this meeting's recorded. Then we find a place where to put it in HealthTree University. Or it might be a roundtable meeting when Greg does the roundtables in different cities and we record the doctors talking about a different topic. We will put it there as a guest lecture. Or sometimes, especially during COVID, many of those webinars that Jenny did, and they were on specific topics, we will just put them in as a guest lecture. And guest lectures are just that, they're lectures. We don't do anything to them except upload them into the correct unit. And I think now I've talked a lot and we're right on time at 3:30. You know, being a teacher, that's one thing you always look at as you're looking at the clock and saying, okay, can I get through everything I need to get through before that bell rings? So the bell's ringing now, it's 3:31. And so now it's time. If there's any questions, I'll be more than happy to answer questions.
Awesome. Thank you so much, Cindy. And I did love listening to you. You can tell your teacher comes on and the way that you were just able to fluidly work through everything and not worry when there was little bugs going on and just explaining it in such a clear manner. You're an excellent teacher. I'm so glad that we have you. If there are questions for Cindy, you're welcome to ask them in the Q&A section that is found at the bottom of your screen. You can type in your question and then we will be able to answer it to the best of our ability. Another thing is if you have feedback or even ideas for us, we are more than welcome in this chapter. We welcome them in this chapter. If you have anything that you would like to see or any questions that you have about the foundation in general. One thing that I wanted to share while the questions are coming in is just kind of the beauty of how much this program has grown. You know, in the beginning, I really think it was you and Paul Jr. who were working together. Paul would crank out the videos and you would kind of direct. And now we have a video team of 6, 7 people who are working on these videos, video production, constantly improving. Now Paul has moved on in the organization and his younger brother Clark is leading the video production team. I mean, it's a big team and they work many, many hours a week on producing these videos. And that leaves a lot of work for you, Cindy. But you guys do an incredible job. And I just kind of wanted to give the audience a little taste of how many hours and how much effort goes into producing this free myeloma curriculum. And we offer it for free because we want to improve lives, the quality of life, the longevity of your life, everything. And we really believe that this myeloma education can accomplish that. So I kind of wanted to share that. Doreen is asking a question, Cindy, do you put dates on the lectures and updates? And I think this is important, especially with how rapid research is being published and things are being changed.
Well, to answer the question, in the beginning, we didn't think of doing that. So if it's an older video, the dates will not be on them. But right now, everything that we publish, we do put the dates because things are being changed constantly. Also, you know, if we're adding a video with some old information in it, we will put a voiceover, like when this video was recorded, this was the only indication, but since that time, the FDA has. So the answer is yes, now we do it, but not all the videos have it because in the beginning, we were just learning.
Yeah, definitely.
We had a lot of learning curves to do. You know, this was, well, we went through many different, what is it called, learning management? I don't even know.
Yeah, learning management systems.
Systems, LMSs, you know, Paul taught me all this technology. I knew how to develop curriculum. I didn't know the technology behind it. Now we have, you know, we have young kids who are in college that are creating animations for us. And it's just, I could tell, you know, Ashlyn, she's one of my video producers. I could say, can you make an antibody that does this and then looks like Pac-Man and eats a myeloma cell? And 3 days later, I have that animation. It's just amazing because I was really intimidated by it. And Jenny said, Cindy, don't worry. You just have to, you know, create the content and ask the questions. We will surround you with people that could do the other things. And she just certainly did. You know?
Yeah, she did. She did. One of my favorite stories that Jenny tells about HealthTree University, she was watching an immunotherapy video that's actually in our HealthTree University right now. and it's about 11 minutes long. But she said, she was like, I'm so into it. I was watching all the animations. I didn't even realize 11 minutes had passed by. And I learned so much because they do put so much effort into these animations, making it fun, making it understandable, making it accessible. So great job with that, Cindy. You and your team really do a great job making learning fun as well, because sometimes people can get overwhelmed with the word university, but I really do feel like this is an excellent way. And even Cindy is saying in the comments, this is an excellent job of setting up a complicated system that is so easy to work with. Kudos.
Thank you. Yeah. I just believe that educated patients have better outcomes. When I started educating myself, that's what I was reading all along. And if I was an educated patient back in 2006, when my diagnosis was degenerative disc disease, and it just didn't seem that I was getting any better, and I didn't know what questions to ask, and I didn't know what I should be doing. If I thought of educating myself back then, maybe I would have been diagnosed sooner, and maybe I wouldn't have lost 3.5 inches in height and had myeloma in 99% of my bone marrow at diagnosis.
Oh
So,
my goodness. Yeah.
and maybe, I don't know how things would have been different, but I would have asked questions. I wouldn't have just, started a treatment just because my doctor recommended it, without even knowing if it was something that's going to work and if there are other treatments available. I mean, just basic questions I just didn't know to ask, and this disease is very complicated, and the further along in your journey you are, the more choices you have to make. And even the experts don't know at this point what is the best, path to choose. Do you do this first and then this, or do you do this and then that? That's a question I always ask the doctors, like, all these BCMA directed therapies, which one would you do next? And they all have different answers just because.
Yeah. Something else along Jenny's journey that she shares is when she relapsed when she was relapsing, she asked for second opinions, and she's very obviously, as you know, Cindy, well connected with myeloma specialists, asked 7 different specialists and got 7 different answers of what she should do, so, and there wasn't any wrong answers, but kind of like you were saying, while it's a blessing to have so many options, it can feel overwhelming. And one of the roles of HealthTree University can be to help educate you to feel less overwhelmed with the significant options that are available to you.
There's one other thing I forgot to share. Can I go back to share again? Is my screen still up?
Yes.
Yeah, okay. Yeah, the other thing I forgot to share is, like, if you are in a course, or no, up the top, there's the search bar. And this was something I probably should have shared from the beginning, because it was something that I was, saying that we needed to have. Suppose that, you have a doctor, you wanted to see all his videos. So Dr. Costa, I could say, what videos has he had? And I type it in, and all courses. And
I think you might need to take this space from.
Okay, because it just came up before. Okay, let me go back again. Let me go to I'm having a little trouble here. Okay.
Yeah, there you go.
Yeah, and it will show me all the lessons he did for us. Suppose I wanted to learn a little bit about, I have this rash and I want to know about a rash. I could type it in.
Just do 1 backspace and it should show up. It's just if you do a space.
Yeah. See, I was growing up, and I know this is sometimes all over social media. Do you put 1 space or 2 spaces after a period? And I was brought up in the age when you did typing, you did 2 spaces after a period. And now I know that's incorrect. Now you only use 1 space after a period. So I always do 2, but yeah. that was a digression, but
Oh, it's
but
fine.
here's like lessons that we'll talk about rashes, and how we get that is through the transcript. So if something's mentioned in a transcript, or it will be there. If it's not, if we don't have a transcript up of that lesson yet, and we're working on getting transcripts of most of the lessons up, or if the person who made the transcript, or YouTube didn't quite understand the word rash, then you might not show up. But
I have a question regarding that. Is there a different product that we're going to be using, or is there a long-term goal to do something different with the transcripts than YouTube so that there is punctuation and it is more readable?
we're thinking of that. There was a point where we were discussing that, maybe having some of the coaches go through it. On YouTube, it's broken a little bit into chapters. So if you watch the videos on YouTube, you could work it into chapters. Yes, we've been talking about it. It's just, we have limited forces, and
Yes.
for me especially, I want to get the information out there,
Right.
whether it's in beta form, without a transcript, without a quiz, without pretty, animations. If there's something important, I just want to make sure it gets into HealthTree University, and then we'll worry about the niceties of it afterwards. And that was a decision that, from the beginning, Paul and I talked about, like, do we wait to launch HealthTree University till everything is perfect, till we have the entire university from beginning to end, and everything is right on in, there's transcripts forever, and there's quizzes and everything? And we said no, because we have this information that could maybe save someone's life.
Exactly. Mhm.
Why sit on it to make it perfect? So this is, HealthTree University is going to continually be a work in progress.
I love it. I love it. Sally says that she's been using HealthTree University for 2 years and has learned more things about it today than she thought possible. So we'll make sure to continue educating on HealthTree University as well. Thank you for joining us today, Sally. And then Marla is saying she wants to know, how's your back pain? Do you still have back pain or pelvic bone pain after all these years?
Thankfully, not to the extent that I had in the past. It was so debilitating, I couldn't do anything. I couldn't even walk, like, from here to the corner. But now the pain is only when I stand still for a long period of time in one position. That's when, or just do an excessive amount of physical activity. But luckily, it's not to the point where, this is bad to say, but I was self-medicating myself with over-the-counter pain medications, enormous amounts, just to control the pain. I missed a faculty meeting one day because I was asleep at my desk. An educated, involved, engaged patient would have been telling her doctor this. I was just being, okay, I guess, this is what's supposed to happen. So I've learned, you need to speak up. Just because your doctor tells you there's going to be a side effect doesn't mean you don't go back and tell your doctor you're having that side effect. He needs to know. So just things like that.
Yeah. Did you have kyphoplasty, Cindy?
I never did, because that was the surgery I was supposed to have when I had all those compression fractures in my back. And my orthopedic doctor sent me for kyphoplasty. He didn't even, he didn't believe me. He thought I had to be in a car accident, or I'd had a fallen out bed, or had some kind of trauma that caused the compression fractures. The orthopedic doctor never, ever considered cancer as a cause for those fractures. But when I got the blood work and it was so abnormal, they would not operate on me. And then I went into treatment immediately. And by the time that I was stable enough to undergo a surgery, the fractures had healed on their own, and the orthopedic specialist at a major university, instead of the orthopedic guy down the road, advised me that, my back was stable the way it was, and they didn't want to mess around, possibly causing it to be unstable.
Interesting. What a journey. I'm glad. I don't know, just hearing you speak about your experience, but then seeing you help others so that they don't have that same experience is very rewarding. Thank you for what you're
Yeah,
doing.
and I'm sure many people on the call today are very involved and never was someone like me, never was the passive bystander who was afraid to ask doctors questions. But I know since myeloma is a disease of older persons, there are many people out there that are still, my doctor said it, it must be right. And I'm not saying your doctors are wrong. I'm saying you need to educate yourself so you could ask the questions that
You need to
be
become
answered.
part of the team. Yeah.
You're part
Yeah.
of that discussion,
Yeah, I appreciate that. Thank you. Sorry, my watch is going crazy right now. Jen from the coach team said that she's happy to help with editing. It's exciting to see people volunteer in this capacity. So thank you, Jen. And then Marla, just one more question from Marla is how many cycles of treatment did you go through? So you started with that. You started with that doublet, and then what happened when you relapsed?
Okay, well, my story is very different than most people's. I did probably about 3 or 4 cycles of Revdex, went through a transplant. 100 days post-transplant is when we found out that my myeloma markers were still the same. My M spike was still around 4.2. I chose at that point, and once again, I don't know if it was the right, an informed choice. I chose at that point to go on thalidomide because it was an oral therapy and I could continue to work because I hadn't planned on retiring, I needed that time to get my things together. But I did retire in that time just because my myeloma wasn't under control. My immune system was compromised. My 10-year-old 5th graders would get sick on me, and it wasn't, and actually at that year, I don't know if anyone remembers, the swine flu was going around. And for children that were under a certain age, the vaccine for the swine flu was a live virus that was a nasal, so, and I couldn't be around live viruses, so it's just not a good thing. So long story short, I retired, stayed on thalidomide for about a year. It slowly brought down my numbers, but I still wasn't in a complete remission. I was getting neuropathy. By that time, the common practice was triplets instead of doublets. So I went back on Revdex, but added Velcade to it. Velcade then was still an IV push. It was not a sub-Q shot. And my numbers started to go down with the triplet. It took me probably another 2 years for my myeloma to reach its maximum response, which was never a complete remission. I've never been in a complete remission. But when I got to what they called a very good partial response, we took away the Dex first, yay. And then after the Dex, we took away the Revlimid. And then I was on Velcade maintenance. I did Velcade maintenance therapy. First of all, it was weekly, then it was every other week, then it was once every 3 weeks. And now I'm still doing Velcade maintenance therapy, but once a month. And my myeloma has been stable with an M spike ranging between 0.1 and a 0.4. So I am not MRD negative. I'm not in a stringent complete response, but I was very, very slow to respond, but I'm very slow to relapse. So like the doctors are saying, I have like a MGUS-like myeloma.
Yeah. We've been hearing in my sessions, we've been talking a lot about that lately, because it seems to be that there's more patients in that category than was originally recognized. So
And sometimes, yeah, and I like sharing my story sometimes because like when you don't have a response to transplant, it's devastating. You think you're not going to be around. I mean, like, how could this really, really, really potent, therapy not do anything, but everyone's different. So I like sharing that. And it took me forever to respond. And it never was a complete remission. And I know in general, people that are MRD negative have a better prognosis than people who aren't. but that's in general. So people need
Yeah.
to know that it's not for everyone. And that's why it's so important to have those conversations about your myeloma with your myeloma specialist, not
Yeah,
what
because
the
your
general.
quality of life, I mean, hasn't been significantly impacted by that once a month Velcade, so how
Right.
is your neuropathy with that once a month Velcade?
I really never had neuropathy from Velcade. I got the neuropathy from the thalidomide,
Okay.
and neuropathy from thalidomide does never go away. It's a permanent
Wow.
neuropathy. So luckily, by that time, I had 2 myeloma specialists. I at 2 different universities, and as soon as I started complaining about it, they took me off. So it's
Good.
not that bad. It just feels like, sandy, feels like you always have sand in your shoes. You're walking,
Uh,
so maybe it's a good feeling, like you're thinking you're at the beach all the time. Look at it
I love that
that way.
perspective. I love that perspective. Julius, my 2-year-old, just learned how to say, "Oh, there's dirt in my shoe." So now he says it even when there isn't any dirt in his shoe. So I never know. That's what that reminded me of. Anyway, thank you, Cindy, for presenting today. I really am just grateful for the role that you play in the HealthTree Foundation. And it's so exciting to see HealthTree University and all of the features that we have there. You guys can join us next month as we hear from our patient experience team as they walk you through how to track your myeloma labs in HealthTree Cure Hub. This is one of my favorite presentations that we do because it really highlights one of the most important, exciting things that HealthTree Cure Hub can do for you in tracking your labs, understanding what your labs mean, and really this is one way that you can also become an empowered patient in your care. So that's on June 8th at 1 p.m. Eastern. You might be interested in other myeloma crowd community events. On the 12th, we have our Northeast Myeloma Community Chapter. We're going to be hearing from Dr. Nupur Rajay, and she's going to be talking about learning about CAR T therapy. On the 17th, we're going to be having our non-secretory myeloma community chapter. We're going to be hearing from Dr. Sasha Tukman, and he's going to be talking about clinical trials for the non-secretory myeloma patient community. And then the 18th is going to be with Dr. Manny Mohudin. He works at the Huntsman Cancer Institute in Salt Lake City. And he's going to be talking to us to the Mountain West chapter about progress and controversies within multiple myeloma. He is a realist. He always brings the good and the bad information to patients, not bad, but real information to patients so that they are aware. And I appreciate that about him. The link to sign up for any of those events and even more events that I did not mention is found at the bottom of this slide and will be sent out in the follow-up email within 48 hours of the event's conclusion. As always, I'd like to thank our sponsors, Bristol Myers Squibb, GSK, Genentech, Janssen Oncology, and AbbVie. And thank you to each of you for helping us build a strong myeloma crowd community. We appreciate you and hope that you have a great rest of your day. Thanks, Cindy. Take care.
Bye-bye.